Hi, I'm Abbas Hassan, a postdoc fellow at the Department of Plastic Surgery at MD Anderson Cancer Center. On behalf of my mentor, Dr. Butler, and the other co-authors, I'd like to thank JACS for the opportunity to share our research on a novel approach using machine learning to predict hernia recurrence, surgical complications, and 30-day readmissions after abdominal wall reconstruction. Ventral hernia repair is among the most common surgical procedures, with over 400,000 operations performed annually in the United States alone. Previous studies reported hernia recurrence rates of up to 42%, surgical complication rates of up to 44%, and 30-day readmissions have been reported to be as high as 13%. These complications can result in higher rates of inpatient morbidity and mortality, higher healthcare costs, and a lower quality of life. With careful patient selection and preoperative optimization, many of these complications can be avoided. It is therefore critical for us to predict which patients are at a high risk of complications to guide preoperative patient optimization and surgical decision-making. However, accurately predicting which patients are at high risk of complications is inherently difficult because of the complex interactions between illness severity, patient characteristics, and treatment-related factors. These interactions can be nonlinear and have elaborate interactions and higher-order interdependencies, which cannot be easily modeled using traditional statistical techniques. Machine learning is a branch of artificial intelligence that focuses on creating intelligent machines that can learn the relationships and patterns between complex variables. Machine learning can help identify which complex combination of patient and treatment characteristics make a patient more or less likely to experience complications and unplanned hospital readmissions. In this study, we developed, validated, and evaluated 9 distinct machine learning algorithms to predict hernia recurrence, SSOs, and 30-day readmissions after abdominal wall reconstruction. In addition, we compared the performance of these models to that of conventional statistical methods in characterizing the predictors of surgical complications. We conducted a comprehensive review of patients who underwent abdominal wall reconstruction from March 2005 to June 2019. The dataset was randomly divided into a training set and a validation set. We then used 9 supervised machine learning algorithms ranging from simple linear to nonlinear to complex nonlinear methods. To assess the importance of the risk factors in the models, we used permutation feature importance analysis. We also used accumulated local effect analysis to understand and visualize the effects of the predictor variables on the predicted outcome. The performance of machine learning models was then compared to that of multiple logistic regression models. We identified 725 patients with a mean age of 60, mean BMI of 31, and a mean follow-up of 42 months. The performance of the models is shown in the receiver operating characteristic curves. For hernia recurrence, the generalized linear model performed the best for predicting hernia recurrence with an AUC of 0.71. For SSOs, the support vector machine model performed the best for predicting SSOs with an AUC of 0.75. For 30-day readmissions, the multiple adaptive regression splines model performed the best for predicting 30-day readmissions with an AUC of 0.74. The machine learning models also achieved an accuracy of 85% for hernia recurrence, 72% for SSOs, and 84% for predicting 30-day readmissions. On the other hand, the logistic regression models had AUCs of 0.65 for hernia recurrence, 0.68 for SSOs, and 0.61 for 30-day readmissions. In this figure, you're seeing decision curve analysis that demonstrate the clinical usefulness of the machine learning models in predicting complications in the validation dataset. Regardless of the threshold used, the net benefit of the models was greater than that of the reference models. In this figure, you're seeing the results of the feature importance analysis, showing the impact of various factors in predicting surgical site occurrences, hernia recurrence, and 30-day readmissions. Higher values in the x-axis indicate higher variable importance. For instance, obesity, component separation, and rectus muscle violation had the highest impact for predicting hernia recurrence. Finally, in this figure, you're seeing the results of the accumulated local effect analysis. ALE plots visualize the effect of the predictive variables on the predicted outcome that are identified in permutation feature importance analysis. Higher values in the y-axis indicate higher risk of SSOs. For instance, obese patients have a higher risk of SSOs, while having component separation was protective. Taken together, the results of this study indicate that machine learning models trained on readily available preoperative clinical data could accurately predict the occurrence of hernia recurrence and 30-day readmissions and SSOs following abdominal wall reconstruction. And it also outperformed the performance of logistic regression. This tool can be incorporated to augment the pre-surgical evaluation of patients in order to identify risk factors and predictors of outcomes, thereby assisting in short surgical decision-making, patient and family counseling, resource allocation, and quality improvement. On behalf of myself, Dr. Butler, and the rest of the co-authors, thanks for listening and thanks for reading.